Okay. It's not live. Thank you so much, ladies and gentlemen. We are members of the Global Association of Clinical Officers and Physician Associates. This is an international association that brings together clinical officers, physician associates, medical assistants, clinical associates, and other titles, close to 30 titles. So I'm flanked here by the members of the Kenya Union of Clinical Officers. I'm here with the Vice Chair, National Vice Chair, Boniface Mitambo, and also the National Trustee, Eunice Chebet. As an international organization, I am Austin Oduor, the President of the Global Association of Clinical Officers and Physician Associates. I want to make some remarks or statement on the ongoing clinical officer strike that has entered day 39 today. It's not live. So, as the Global Association of Clinical Officers and Physician Associates, we stand firmly in support of the clinical officers who have chosen to initiate the industrial action which began on 1st April 2024. Our unwavering support stems from a deep-rooted commitment to advocating for the rights and well-being of the healthcare professionals worldwide. The demands put forth by the clinical officers in Kenya are not only justified, but also crucial for the advancement of healthcare systems and the delivery of quality patient care. We fully endorse their call for ratification of the collective bargaining agreement, implementation of a comprehensive scheme of service, and the urgent employment of additional clinical officers to alleviate the burden of existing healthcare workers. It is imperative that healthcare authorities and relevant stakeholders heed the voices of these dedicated professionals and take concrete steps to address their legitimate concerns. Failure to do so not only jeopardizes the welfare of clinical officers in Kenya, but also undermines the effectiveness and sustainability of healthcare services in the communities around the globe. As a global body, we stand in solidarity with the clinical officers who are doing their 39-day industrial action and pledges to continue advocating for the rights and recognition of healthcare professionals worldwide. We want to say that Gacopa has presence in more than 40 countries worldwide, and Kenya being one of them, through the Kenya Union of Clinical Officers and the Kenya Clinical Officers Association, together with other relevant bodies, the Clinical Officers Council and all those, we work together. And you realize that the 30,000 plus clinical officers in Kenya have been agitating for what we've already mentioned there. And we are saying that from next week, more than 30 presidents of different associations in those countries that make up the Global Association of Clinical Officers will issue solidarity messages in support of this ongoing strike. And we urge the President of the Republic of Kenya that this issue of clinical officers is not only affecting Kenyans. The clinical officers and physician associates around the globe are always the people who are frontline health workers, and they're key when it comes to the issues of UHC and primary health care. So we urge the President of Kenya through the Minister for Health to help resolve this issue as quick as possible and come up with a return to work formula that will be agreed. So before I end, I want to give the National Trustee of the Kenya Union of Clinical Officers, who we are with here, to make a remarks. Then I hand it over to the Vice Chair, and then we'll make a closing remark. Thank you.
Thank you, Mr. President, for this opportunity. And I want to appreciate the global presidents who are in support of this industrial action of clinical officers strike. And my comment today, as we are marking our 39th day of the strike, we are urging the government, which looks adamant about our legal strike. I want to urge them today that let them calm down and listen to us and know that our grievances are there to be solved, and we are doing this because we want the government to recognize the work of clinical officers in Kenya. As we talk now, most of our facilities and our patients too are suffering because we are not working. So I want to urge our government to calm down and listen to us and listen to our agitations and make sure that we go back to work and attend to Kenyans as a whole. I appreciate and thank you. Back to you, Mr. President.
Thank you so much. Now we give the chairman of the Kenyan Union of Clinical Officers, the vice chair, speaking on behalf of the union.
Yes, good morning everyone and fellow comrades across Kenya and across the region and worldwide. As the President Gacopa has already enumerated, we have different issues that have taken us as Kenya Union of Clinical Officers to the streets for an industrial action. We are out because of a number of issues that the government has not been able to come on the table and be able to complete our negotiation, which had been going for almost over 7 years. Among the top list of our grievances and the issues that we have been pushing is including the CBA, that is collective bargaining agreement. There is also the issue of the risk allowance, this issue of the payment of interns as per the approved staff establishment by Public Service Commission. There is also delayed promotions and redesignations, which are cutting across different counties. So at this point, when we are marking this day, that 7th day of our nationwide strike, we are requesting our comrades that we continue at least listening to the voice of the union through the office of the Secretary General, even as we continue being on the street, so that we can continue even pressurizing the government to come to the table. One of the challenge that we have been facing is because of the Council of Governors, which has not been able to come to the negotiating table. We thank at least and we appreciate the Ministry of Health for agreeing to come on the table. There is a number of issues that we have been able to make progress in terms of our negotiations, but with the Council of Governors, they have not obeyed the court orders, and they have even not obeyed the directive by the Senate. Today we are supposed to be having a negotiation with them at the head office of the Council of Governors, but they ended up postponing it. So what we are urging our members is continue standing in solidarity despite whatever the pressure and the intimidation that are coming from the side of the government. We are going to be able to overcome it because our strike, it is legal. And as we await for Thursday, that is on 9th, for the judge to be able to give directive about these negotiations. We want to urge our members to continue coming out. Today we are going to be having our march from the Green Park to the Ministry of Health. Then from there we'll be able to proceed to the SRC. Then from there we'll go to the COG, and then be able to wind up our marches at the Public Service Commission, because there are still a number of issues that we have not been able to agree. So we want just to continue calling upon our members to keep their resilience and to keep the spirit of solidarity until we be able to win all the issues that have taken us out into industrial action. Thank you, and we really appreciate for your continued support.
Thank you so much, Bwana Vice Chair of the Kenyan Union of Clinical Officers. So as we wind up, I just want to inform members that we will be having our 4th Global Association of Clinical Officers and Physician Associates International Conference in Gaborone, Botswana. It is confirmed. It will take place between the 26th and 29th in Gaborone at the DDT College of Medicine. The main theme of the conference is universalizing the practice of clinical officers, a global synergy, because you see the reason why Gacopa was formed, we want to have that harmonization of our practice so that the clinical officers or the physician associates or the medical assistant can work from one country to another. Remember, our 3rd conference that took place in Malaysia, Kuala Lumpur, was a success, and we are rallying upon all our members that you will visit our social media pages, and that conference will be very huge, and we expect huge attendance. The guest of honor will be the President of Botswana, His Excellency Masisi. So with those many remarks, we will end this press conference here until next time. Thank you so much.